안녕하세요. Today I will talk about chapter 26 from book Pediatrics Necessary Clinical Approach. Chapter 26 Child Abuse and Neglect. The dental professional's role safeguarding children. I will talk about definition child abuse and neglect, and also prevalence of the child maltreatment and risk factor for exposure to maltreatment, social service, child protective and support, and recognition of child maltreatment, physical abuse and psychological abuse, sexual abuse, and for forensic oral examination. Definition of child abuse and neglect. This table definition of child maltreatment and it is competent. Show the type of the abuse and a definition. Child maltreatment is often used in universal terms for all types of abuse and neglect. There are 4 types of the abuse, including in the term child maltreatment, physical abuse, emotional abuse, ill-treatment, better violence, including sexual abuse and neglect. Preferences of child maltreatment. In illustrating countries of the preferences of the group health, approximately varies from 5 to 35%. Sexual abuse of girls ranges between 15 and 30%. Of the boys, it's 5 to 15%. Intimated brother and influences varies between 8 and 25%, according to 2014 report by World Health Organization. 23% of adults report to have been physical abuse of the children. 36% report previous experience of emotional abuse, and 16% report child neglect. Risk factors for exposure to maltreatment. One the major risk factor. One is major risk factor intimated parental violence in children who who live in families where there is violence between adults and often exposure to physical abuse themselves. In addition, they witness with abuse of another family member, which is psychological abuse is in itself. It is important for the general dental professional to recognize the adult's exposure to intimidated parental violence when dealing with a child maltreatment, and not focus solely on abuse directed toward in the clinic. Social service, child protection and support. The social service organize interagency cooperation between police, police and schools and health organization, and they decide or succeed appropriate intervention according to Social Service Act. The social service also work with the children house, which are a place for interagency cooperation. Recognition of the child maltreatment. Child maltreatment can be recognized or suspected when finding physical sign or symptom by observing behavior which the child or in the interaction between the child and adult, or by direct disclosure from a child, a parent, or a third uh, party. The child abuse can also be suspected when treating an adult without having met the child, where suspicion is raised regarding intimated parent violence. As always, thorough social, medical, and dental history should be taken in the clinical encounter with adults and children. Physical abuse. Inflicted injury can be found on the whole body, though not always recognizable to the dental professional due to its location, different objective, for example, hand and belt, and many other things can affect the physical injury, as the facial region is often injured during physical violence. Bruising is common after abusive injuries, and patterns of the bruise, bruises can help to identify previous abusing. Also can be found the mouth due to bottle feeding infants with overheated drink, or with a hot spoon during feeding, or by immersing with the child scalding water. Cigarettes can causes the lesion that will small and circular circle on the skin, and bite mark on the skin can appear, bruises and precision and laceration. Laceration. Separating accidental injury from non-accidental injury. When the child presents with injury in the dental setting, the dentist must be evaluate whether the injury is accidental or non-accidental. Non-accidental processes can be separate from accidental process on the basis of the age of the child and pattern of the process. In this picture, it shows the slap mark on the cheek, the finger and the hand will leave impression, and also the figure 26, also grabbing child cheek during forced feeding will leave impression of the thumb on the one cheek and impression of the four other finger on the other cheek. That this triangle is the triangle of the safety, ears and side of the face and neck and top of the shoulders, is rarely subjected to accidental injury, whereas accidental trauma more often occurs in the other parts in the body and the face. Bony prominences. This picture, a typical accident injury, show the common place for typical accident injury, and also in the second picture, B, typical abusive injury. This is triangle of the safety, ears and side of the face and neck and top of the shoulder. Psychological abuse. Sign of psychological abuse are most likely found when observing the child behavior and interaction with those around them. Possible signs in the child behavior are emotional frustration and submissions and aggressive and lack of the concentration and social skill. Neglect. Child neglect can be recognized when parents or caregivers fail to provide basic needs, for example, food, clothing, medical and dental care, education, and protection from danger. Uh, Persistent and general neglect can be result to uh, failure to thrive, which manifested as poor weight gain and growth retardation and delayed development and abnormal behavior. Oral and dental aspect of child maltreatment. Physical abuse through the study have shown that the prevalence of the intraoral injury is low. Traumatic injury, for example, the fracture on the teeth, root, and alveolar bone, intrusion, luxation, and effusion are found. Sexual abuse, reconciliation of the childhood. Uh, Sexual abuse is difficult, has different and broader the manifestation. The sign recorded by dental teams may be associated with the physical, emotion, and dental symptom. Um, Unexplained injury, teeth, or the palate, but partially petiated, petition the at the junction on the hard and soft palate may be sign of the forced oral sex. The child or the adults may be also react with a dental fare, showing in several studies the adult women refuse experience the sexual abuse. Poor self-perceived oral health is also associated with forced sex. Dental neglect. Dental neglect, defined by American Academy of Pediatric Dentistry, willful failure of the parent or uh, guardian to seek and obtain comprehensive dental treatment necessary to ensure a level of oral health essential for adequate function and freedom from pain and infection. In this box, show the possible differential diagnosis when suspecting child maltreatment. And also in the second box, show the sign and symptom suspective of dental neglect. For example, repeated the toothaches and emergency visit and distributed sleep, not taking the part of daily life activities, playing with the friends and kindergarten and school, and repeated prescriptions analgesic and antibiotic, and repeated to referral to treatment under general anesthesia. Managing and substitution of a child maltreatment. Any substitution of child maltreatment should be reported the social service or the dental professional must be trust uh, their own judgment. It's called clinical practice and helpful to have local and national guideline on how manage the suspicion. The guideline should be easily available for all employees and preferable on the local internet and um, in the paper form and should include uh, critical information and how to write the report and contact information for the local social service. This box the good clinical practice for local guidelines. Uh, List of the signs of symptom indicative of the child abuse and neglect and appropriate question and information to ask and share with the child and the family. Prefabricated form to report the suspicion. Contact list for appropriate contact with address and telephone number with the social service and police on the local level. Management of dental neglect. According to British Society Pediatric Dentistry, three-step intervention could be carried out when dental neglect is suspected. First one, preventive dental management. Second one, preventive multi-agency management. Third one, report to social service. Interview with the children and families regarding suspicion of maltreatment. The child has the right to be listen to from the child perspective. Children who have been abused and neglected maybe never tell and hesitated to share information about their situation. When asking regarding the experience and violence, it is important to be alone with the child, use open question, and allow time for response. Responded truthfully and inform the child of the obligation to report and never promise to keep a secret. This box show the useful question when you suspected child maltreatment. For example, you can ask them about how they have several accidents with not show up for dental treatment without responsible explanation, refuse concerns about the child and siblings. And this box also recommendation for appropriate response for the child and disclosure. And also useful sentence during the disclosure. For example, you were very privy to talk about this. I am glad you are telling me about this. I am sorry uh, that this has happened to you. I will do everything I can to help. Forensic oral examination. Both of the police and prosecutor can request forensic report from dentist regarding the child oral health status, or request the dentist to give expert option on traumatic injury. This box practical guide to consider when requested to write the forensic report. Always use specific recommendations and guidelines pertinent to each country. Health implication of the child maltreatment. Child abuse and neglect is a problem all over the world that continually impairs with the health and well-being of the children. All forms of abuse can cause negative, long-lasting consequences for healthy and education and future parenting ability. Another serious consequence including physical injury and or death during childhood. Thank you very much.